What makes Hatfield Medical Group different and special is that we prioritize the patient relationship over everything else. We do that in so many different ways, in so many little steps, little touches with each patient, but really caring about people is at the core of what we do.
Hello, my name is Dr. David Hatfield with Hatfield Medical Group. I am the Chief Medical Officer for Hatfield Medical Group. Hatfield Medical Group was started by my father some 50 years ago in the East Valley of Maricopa County. We started to see a change in outcomes in our practice as we started to give our physicians more time with patients, as we started to outreach our patients more frequently for preventative exams, as we started to create access to care on our schedules so that we could offer same-day and next-day appointments available.
You can see primary care providers on every corner throughout the East Valley, and they're really all about the same. What makes us different is that we are incented and motivated to keep our patients healthy and out of the hospital. So I think that's the biggest difference. And all of our patient engagement is based on that mission.
We value our mission and our mission statement of providing quality, compassionate care to every patient every day. It's not just what we say, it's what we do for our patients.
I'm Ebony Fields. I am one of the senior community health outreach reps here at Hatfield Medical Group. Here at Hatfield Medical Group, we practice a value-based care model that is focused on making sure that our patients receive quality, compassionate care. Our providers are paid by the quality of care they give to their patients versus the fee-for-service model by being paid by the volume of patients they see.
My name is Garen Furman. I'm the Chief Operating Officer at Hatfield Medical Group. In medicine, there are a lot of interactions, thousands every day. And within every interaction, there's a transaction and a relationship. At Hatfield Medical Group, we focus on the relationship. We focus on the fact that we know you, we care about you, and really we're family. That's what Hatfield Medical Group is all about. When you know everybody that you interact with, when you know your care team, then they are more familiar with the things that are going on with you. They know the things that are going wrong, they notice those things more readily, and they're able to celebrate with you when things are going right. In medicine, we call that continuity of care, and it leads to higher patient outcomes, better quality, and a better patient experience from the front door all the way through with the provider.
It's just a real comforting feeling knowing that you can call your physician in an emergency and they can say, come on in. Right off the bat, they made us feel like we were home. And Bill says, I like this place. So do I.
So in the last 6 months, Hatfield Medical Group has doubled in size. We went from 4 clinics to 8. We already have the next 2 acquisitions. By 2024, we'll be at 50 clinics. So we accept all Medicare patients, all insurance plans, and we're constantly seeing new patients. We're always expanding as we need to based on what the community needs.
We truly believe in our mission statement and providing that quality, compassionate care to each and every one of our patients and the culture we have established. From the minute you walk in to the minute you walk home, even when they go home, we follow through with what we're saying and what we're going to do and making sure that our patients are taken care of.
My name is Thomas Fredrickson, Director of Community Health Outreach with Hatfield Medical Group. So at Hatfield Medical Group, we value the relationship that we have with our patients, and we understand the relationship our patient has with their agent is extremely important as well, and we always want to protect that. And one of the biggest things that we do is when we partner with an agent and they send new patients to us, we're going to call that patient, we're going to welcome them to Hatfield Medical Group, we're going to explain who we are and what we do and why we do what we do, just to make that first visit a little bit more comfortable for them. And then something that's really cool is we're actually going to meet them at that first visit. So we'll meet them there, we'll help them come in, we'll help them with new patient paperwork beforehand, or if they come early for that first appointment, And we want them to have an experience that they're going to love and know that this is the type of care and customer service that they're going to receive not just at their first visit, but at their 10th visit as well.
Working for Hatfield Medical Group has been a great experience for me. I love waking up every morning and going out to the communities, giving people tours, and making sure that they're aware about the services that we offer at Hatfield Medical Group. I think the most important thing is how comfortable the doctors, the staff, and everyone here at our offices make everyone feel. So we all work as a family, we all work as a team to make sure that the patient's life is to make sure that the patient is well taken care of. And I think that's the most important thing. If I had someone that was going to come and see one of the doctors here, I would recommend them just because I know how great the providers are and the staff is.
Without Dr. Lewis and Dr. Ambrosia, I probably, according to what I understand, I would not be here right now. We have recommended the majority of our family and the majority of our friends that were looking for a doctor or needing a family doctor. They've certainly been recommended to Hatfields because of the treatment that we have received.
One of the really cool things that we have at Hatfield Medical Group is a team of community health outreach representatives. The goal of that partnership is to be able to have agents out in the community working with our outreach team. They can work together at events and partner at an event where an agent can talk about what he does and an outreach rep can talk about health education and different things we do in the community. But the goal is for those two to work together and to build a partnership and to attract new patients to Hatfield Medical Group, but then also give your customers the best customer service when they come into Hatfield Medical Group.
Hatfield believes in the relationship with patients, starting with when you call and schedule. So from the schedulers to the front office when you arrive for your appointment. You have a consistent MA that works with the provider that you see regularly. You have a consistent provider that you're able to see. You have an office staff that you're very comfortable with. If you have a chronic medical condition, then you might see a chronic care coordinator who would make monthly contact with you and follow your healthcare needs for as long as you belong to that program.
That is the underlying reason that motivates me to come to work every day, that we are truly helping our patients. We're getting to know them as people, not just as a patient, and that we're reaching out to them in the way that they deserve.
I'm Daniel Ramos. I'm one of the medical providers here at Hatfield Medical Group at the new Apache Junction location. At Hatfield Medical Group, we intentionally limit our patients that we see per hour. We want to get to know our patients a little bit better, so we spend a little bit more time with them. Sometimes as we age, we need a little bit more time to understand our complex medical needs.
I like the way that as soon as I go into my Red Mount facility, that the girls at the front desk know me. They say, "Oh, hello, Mary Jo, how are you doing today?" They greet me by name. They're friendly, they're upbeat, they're cheerful, they're always wearing a smile, and it just makes you feel good. I would think that regardless how bad a person felt going into the office, just going in and being greeted like that would give you a lift. I know it does me.
I'm Angie Hartfield, the Senior Director of Managed Care at Hatfield Medical Group. We have a dedicated patient service coordinator at each one of our clinics whose entire job is to support our patients on their Medicare Advantage plans. So we want to make sure that they have the best patient experience possible when they come into the clinics, that we're retaining them on the plans that they came in on so that they're comfortable and happy and utilizing all of the benefits. And then last, we want to make sure that they're educated on the benefits that are available to them, and if they don't have access to those or they have an insurance plan that they're not happy with or not comfortable with, we're able to educate them on their options and get them connected to somebody who can really help them determine what the best coverage option is for them.
Medicare and any of the insurances can be really hard to go through. There's so many things that you need to know, and there's so much to read, and sometimes it's overlapping, and they take care of everything, so I don't have to worry about it. And if I do have a question, I can just call in and ask, and they'll let me know what I need to know.
I had a sister who passed from breast cancer 5 years ago, and I'm raising her 2 daughters, and we got to see how we navigated through healthcare not understanding some of those insurance benefits, not understanding the care that she needed, not understand, the obstacles that she had. And so as I've gone through this position and been a part of it, I am 100% compassionate and have passion in what I do. I believe every patient needs to understand the whole approach, all of it. They need to understand their benefits and also what else is available to them, so that they can have a better quality of life. And I hope that I'm that person that can make that change.
We want agents to know that we're protecting their book of business and their client. Their continuity of care and support is extremely important to the patient and to the agent. We want to make sure that they know that they have access to that type of support at Hatfield Medical Group. The feedback that we've gotten so far is extremely positive, and patients are super excited to have assistance with their insurance plans, which can oftentimes be very confusing and hard to navigate. So having a dedicated person on site is really nice to have.
Hi, I'm Flora Alvarado. I'm the Director of Quality and Care Coordination here at Hatfield Medical Group. We have a great program here with a team of people looking to outreach our members in regards to their preventative measures. We have many areas in those preventative measures that includes mammogram, colorectal cancer screening, diabetic measures, and making sure that they're adherent to their medications. Our CCMs work very closely with our patients in terms of their benefits. They'll call the health plan if they have to understand that patient's insurance and understand the copays, understand that over-the-counter benefits, and be able to relay that information and communicate it to our patients every day. So they're very well versed in the insurance and whether that fits that patient or not.
We help our patients get to specialists when we can't provide the services that are needed.
I feel like as a behavioral health coordinator, I get to help patients who sometimes maybe slip through the gaps. Mental health is such an important role in any healthcare industry, so I think helping patients who maybe wouldn't have gotten that support anywhere else, bridging the gap between their primary care provider and their psychiatrist.
As a community health lead, I oversee our chronic care coordinators, and we try to understand the obstacles that are preventing our patients from receiving the care that they need or that they deserve.
We actually had a patient who was struggling with breast cancer, and she was undergoing chemo, and she lost her rent check. And we recognized that there was a need to take a deep dive into her life, more than just that medical perspective, and understand why she was suffering through what she was suffering through. In the phone, I made a phone call. I actually reached out myself and made a phone call and said, hey, tell me what you have in your fridge and tell me what you have in your pantry. And it turns out that this patient was undergoing chemo. It was 117 degrees out on an Arizona day, and she had no AC running. She actually had a fan on. She had put a towel in the freezer and said she had $5 to her name because she'd lost this rent check. And we understood that it was important that there was a program available to her here at Hatfield Medical Group to be able to take these deep dives into our patients and understand and know why this happens. And so through that process, we initiated the Chronic Care Management Program, which allows our team of people to outreach our patients and ask them questions about social determinants of health that includes, hey, not just are you adherent to your meds, but are you also taking your blood pressure? If you ask a patient if they're taking their blood pressure, they're going to tell you yes. We want more than that. We actually want to know, what are those numbers? If your mental health feels well, are you exercising? Do you have water in your fridge? Do you have the air conditioning on? Those are important. And as we've built this program, it's actually been great to see that we've received such details from the patients, intimate details of their life, and found out that there wasn't food on their table, that they couldn't go buy that medication because utilities was definitely more important than that medication. So through this program, we're able to outreach quite a few members every single day.
Hatfield Medicine has just been there when we needed them. Like I said, if we needed to get in that day, they would take us. If not, then we would make an appointment with the doctor that we wanted, and they've just been efficient. And we've enjoyed, well, if you enjoy medical experiences, we have enjoyed them.
I'm Morgan Roberts. My current role is Director of Patient Engagement. So what we learned when we acquire and partner with new clinics is that those patients are very familiar with, they're interfacing with the same people over and over and over. So when we magically would acquire them and then centralize the phone system, all of a sudden they're talking to people that they don't know that well. Sometimes they're talking to some of our agents that aren't that familiar with the current practices at that local clinic. So one of the things that we recently implemented was a model that we call a pod, where we bring 2 or 3 people from central access into that pod, along with some front desk people from the clinic side who these patients are used to talking to. And those are the patient engagement folks that they deal with all the time. So anytime they call on the phone to get a hold of someone from a particular clinic, they're talking to the same people. And there's also this synergy between our central access or our corporate office and the clinic that all of a sudden magically happens that wasn't there before.
So there was an instance when a young lady gave us a phone call. It was in regards to her father. Her father actually suffers from Alzheimer's, dementia. So she just needed someone to vent to, someone to, talk to, just because, it could be a difficult situation with, the medical conditions. So I spoke with her for over an hour, and I got her an appointment. But, just building up that rapport, speaking to her, just someone to vent to is what, what made me feel happy inside, just knowing that I helped someone. So that was an instance where I felt really, really proud to work at Hatfield Medical Group.
What makes us different than any other family practice is the feeling like a family, warm and welcoming, and also the culture that we provide here at Hatfield Medical Group.
So I started in healthcare as in laundry and in housekeeping. I started, cleaning hospital rooms and delivering laundry to all the floors. I went into laboratory and was, doing all of the clinical laboratory science. Had my master's in science and laboratory medicine, and just what I was seeing in healthcare is a little bit of a disconnect with the patient, right? And I wanted to be a leader that could really prioritize the patient and really care for people in a powerful way. And so that really drove me to go into healthcare, and specifically into primary care, because it's in primary care that you can have that deep, long-term relationship with patients, that you can be their partner for life in health. And that's something that is so unique and so special in healthcare, and really special in all of the world in terms of what kind of job or career you could choose. And so when I saw in healthcare a lot of the decisions that were being made that didn't align with that, preserving that relationship, that kind of sacred connection, that's what drove me into healthcare and into primary care. That's what really brought me here with Hatfield, is that I found a group that understands that prioritizes that. That's why I'm here, is to really create a environment in healthcare that prioritizes the patient, prioritizes the relationship that we have together, and that keeps that sacred.
My dad taught me years ago that you are what you do, not what you say you will do. At Hatfield Medical Group, we have data that supports that we are delivering on our promise to deliver quality, compassionate care to every patient every day. I would invite any of you as agents to bring your clients in, take a tour of our clinic, watch it in motion, meet our providers, and see the difference that happens in Hatfield Medical Group clinics every day.